What happened to you now?
Oh, I have pain in the back,
In the back?
lower back and the neck as well. So
Lower back.
it's just like shooting down towards the legs.
I see. Shouldn't that?
And yeah, all the way to if I stand and walk up step, it pains. It keeps on.
So when you walk, like you.
Yeah, the pain
You feel pain?
continue pain.
Okay. For how long? Couple months? Couple years? Like how?
It's been for a long time.
It's
But
been
the
long?
pain started very severe last 6 months.
Last 6 months.
Last 6 months. That's very severe.
Oh wow. So what happened to you? You fell down, casting surgery.
No, I had a L4, L5 disc bulge.
Okay. How do you know? You go to MD med doctor,
Yes.
take X-ray, MRI.
Yes, not here, but outside.
Outside.
Outside of US.
I see.
But they said they gave me 2 injections for
Like steroid injection.
steroid injections.
Like how was it? You feel better?
I feel better the first injection.
Oh.
I thought I might go for second one because it was feeling better. But after second one, the pain was gone for a while and then it came back again.
To come back again.
Yeah.
I see. For like 6 months, more than 6 months to 1 year already.
2000 and probably 21, 22.
21, 22.
That's the
So.
injection that was in 2020.
Oh wow. So 2-3
But-
years already.
Yeah, 2-3 years old.
I see. Okay. In US or in other country?
In other countries.
In other country? Like you, where you from?
I'm from New Zealand.
Oh, okay. So other country from New Zealand to the injection, I see. And then, like so many. Where do you feel pain? Here or this low back?
Yeah, from here all the way go towards the left leg, all the way down.
Go all the way down to
if
the feet.
If I stand up, it feels all the pain both the ways.
I see. Okay, so like low back. Okay, like lean back, you feel more pain or lean forward?
Lean forward is more pain. Lean back is less.
Lean forward is more pain.
Lean forward is pain.
I see. Okay, how about rotate one side?
On the side, it feels okay.
How about this side?
Yeah, this one makes a noise, but that's
I
okay.
see. And then you mentioned leg pain too.
And see what cervical C6 and C7 too.
I see. So like from 1 to how about the low back? From 1 to 10 times worst pain, what's the level? 4, 5, 5, 6, 6, 7?
Before it was less, but now even if I stand and walk, it's like 7, 8.
7, 8.
Yeah, walk just because it's a continuous pain. It's just like pain. Even you do anything like walk or back.
I see. So you mentioned left leg go all the way down to your feet.
All the way towards the feet.
Is it like you feel pain on the big toe or little toe? Or
I feel pain right now.
yes.
But when I sit down, it's not too much pain. But when I stand up, I put my body weight.
Oh. So you go all the way down to your feet?
Yes.
Oh wow, sciatica. So I'm gonna explain to you for more detail, okay? So like what else have you tried? You mentioned about like have you tried MD medical doctor? Like what else have you tried? Acupuncture, physiotherapy?
Oh, I've tried everything.
You tried everything?
Yeah, I've tried physiotherapy. It gives me better. The pain is for 2-3 weeks. It's okay. Then after that the pain starts again.
I see. So what else have you tried? Physiotherapy?
Physiotherapy, but mainly physiotherapy.
Oh,
Acupuncture
do exercise, right?
Yeah.
Oh, okay. So, and then when you say physical therapy, like 1 time, 2 time, couple months, like how?
Let's say about a month.
Oh, 1 month, and then you say the pain come back.
Yeah, that's okay.
I see. Okay, I see. Okay, good. So I'm going to explain for you at the same time. I think I explained to you already. The machine, what I have is called Focus Shockwave machine. I'm going to explain to you for more detail. Okay. Like low back, right? 6, 7, 7, 8.
Right.
And then neck 2.
Neck 2 is same thing.
Same
Same
thing.
Same thing with that.
7 to
7 to 8. Because I can't feel even sleepy. No pillow. It's okay. But with pillow, that's problem.
Okay. So what happened to your neck?
C6, C7.
C6. Did you fell down here something?
No, it's a bulge, but nothing. Nobody did anything for it.
I see.
It's just still there.
Okay. So like pin and sign everything page. Okay. So front and back. Like do you have ID with you? ID,
Yes.
driver license. Yeah. Click like you want. These can it work?
Yes.
Okay. So I try to fix one area first. Maybe low back. Okay. So like ID. Do you use any insurance? Like you may cash, right? Oh, that's fine. Like good. Okay. So like just at least your driver license. whole body move that a little bit. Oh, this too much. Okay, good. Okay, it's good. Okay, so this one is a open mouth, like you need open mouth, look straight and don't move. Facing the wall, okay? Okay. One hip, okay? This one hand and elbow together. That's good. Okay. So step forward a little bit. Okay. Like whole body move forward. Okay. Good. Okay. Step to left. Okay. Step to the left and heel push the wall. Okay. Step back. So you can compare this X-ray to this X-ray. You want to come here? So I'm going to show you something. So this is 1960, 65, 66 years old. The curve should be like this. Number one, you lost your curve. Number two, okay, all the bones should be very smooth. Like this bone spread, right? Later on, if you don't fix it, bone spread almost they fuse together. Right. You go like this, get more and more. You will get more stabilized. So you went out 2, 3 bone, right? This is bone spread. Yeah, can you see this? Sharp edges coming out, okay? So let me explain to you. The measurement lapping upper back, shoulder pain, right? Okay, C1, C2, C3, C4, C5. Between these two bones, this and this, right? This bone, this bone. So you can compare this one. Like you can compare this here to here. So this compares so much. This one, right? Can you see this? So when this is compressed, it pinches the nerve. Okay. Okay. Okay, decrease some power. Okay, take deep breath in, inhale, exhale, all the way out. Good, okay, one more time, inhale, exhale, all the way out. Okay, and one more time, inhale, exhale, all the way out. Okay, okay, good, bend on that for me, good. I'll get some chest and first, good, elbow. Oh, you feel pain already?
Yeah, no,
Like
there's no pain.
Your pants tight, yes. Good, okay, time to the other side. Maybe next time wear like loose pants is easier.
Yeah.
Good. Okay. This hand is good, good. Yeah, low back tight. Okay. On your back facing up. Yeah. Okay, good. Go side up. Move up a little. Okay, that's good. Stay here.
Oh yeah.
Oh wow. So lift weight with your hip. Okay, good. Okay, relax. I'll be super gentle first time. Okay. So anything move neck, upper back?
Yeah.
If you feel. Okay, good. Okay, so I tell all the patients, like, make sure when you get up, yeah, oh, this is good, turn body sideways, elbow hand push, yeah, that's good, it's good, perfect, okay. So let me explain to you, okay. You saw X-ray, your disc compressed so much, you pinch your nerve, which nerve, okay. Here. Okay. Oh, here. Oh, wait, guys, okay. So okay. So like you mentioned about leg pain, upper back, all these yellow colors your nerve, right? Okay. Because your disc compress so much it pinch your nerve. When it pinch your nerve, it go all the way down to feet now. So what I do right now, my solution, okay, I try to decompress the spine, decompress, make more space for all this nerve. Okay, yeah, your hand do like this, okay. Because I try to decompress the spine, I try to carry you on my back. Okay, let's see if I can do this. Okay, relax over back, give it some space. Okay, yeah, relax over back. Okay, make sure just relax, relax. Okay, relax. Good, little bit. Yes. Okay, good, relax. Yeah, upper back, relax tight. You feel better?
I feel like the pain is gone, like almost, it's like 20%, 30% right now.
Oh.
But the pain is gone.
The pain is gone?
The uncomfortable, the thing I was feeling all the time, sleep or walk.
Uh-huh. So how about you want to walk a couple steps here? Just tell me. Yes. So how do you feel? Is it bad?
It feels better, yeah.
You feel better, right?
Better. So it's like just no pain.
No pain?
Yeah, no pain and comfortable, walking.
Okay. So when you come here, you mentioned low back like 8 to 9 for low back, and then that like what's your low back? Your pain level now? What was pain level?
Right now the pain level reduced like almost 3.
2, 3.
2, 3.
2, 3. Oh wow, that's good. How about your neck? You mentioned neck pain.
Neck pain is almost like 2.
2, 3.
Yeah, 2, 3.
You come here 7 to 8, right?
Yeah.
Yeah, so it's only 2, 3. So, but I can tell you, okay, so like the machine is not miracle. So 1 time, 2 time, like you feel a bit better. I can tell you, usually the patient tell me the pain come back 2, 3 days. Yes. So you need to be consistent. Try for at least for 2 months, and then it will last longer. 3 days, 4 days, 5 days. So 1 time, 2 times, just temporary relief. But like first time, you feel much better already. So you feel better already, right?
Yeah. So I think you feel like.
Yeah, a couple more sessions, you feel like the pain like should decrease. Okay.